New research shows training in teamwork and communication translates into better performances by teams of pediatric specialists who respond to cardiac emergencies, also known as a Code Blue.
Teamwork training for resuscitation involves teaching 5 to 7 healthcare providers, which include physician, nurse, and respiratory therapists all together in a simulation environment. It lasts a full day, and our aim is to provide that for all new staff, but also for our staff on an ongoing basis, at least every year, and we anticipate running that every couple of months.
The doctors, nurses, and respiratory therapists on the Code Blue team already have the medical knowledge and skills to respond effectively. It has now been shown that training in non-technical skills helps these teams perform even better.
It solidifies the interaction between teamwork and our clinical performance. Studies have tended to focus on one or the other, and we're one of the very few studies that have actually looked at teamwork and how it affects our performance at our job. And we found that people's ability to adhere to the guidelines that are published on how to resuscitate somebody were better if they worked better as a team. So we didn't teach them what medicines to give or what electrical activity to give or anything like that. We just taught them how to work as a team. But despite that, they actually gave medicines more quickly and with fewer errors, just having worked together better as a team.
Okay, everybody clear? All clear, all clear. Energy delivered?
I ran a large study to confirm this with our colleagues in Edmonton, Toronto, and Montreal. And we ran 300 healthcare providers through this course, or 51 teams. And so now each center is looking at implementing this training long-term, so that it'll be part of our culture here and part of our normal education.
The study used computerized lifelike mannequins that could be programmed to simulate different medical emergencies and respond to treatment.
So these are what are called high-fidelity mannequins, meaning they're run by a computer. And that way we can actually change their vital signs, whether they're breathing or if they have a pulse or not, and change it while the scenario is going on. So if we want the team to do a different thing, we can change the scenario to help them go down a different path. Simulation has really changed how we teach in healthcare and has allowed us to broaden the different types of skills that we emphasize, like teamwork.
I think it underlined how key it is that we have open communication within a team when we're trying to work hard together to save a child. Being free to talk to one another, being open about what we're seeing, what kind of reactions we're seeing in the child, really saying out loud what kind of medicines we're giving, confirming with each other that what we're doing is correct is very, very important. The end point is saving children's lives. And if we can use this new communication method and just this free way of being with each other and teamwork, that end point of saving children's lives is going to be met better and faster.